So I'm Val and Joanne is joining me to present. As you'll see, I thought rather than having a photograph of ourselves, we'd put up our pseudonyms. So we called ourselves the A-Team as a sort of a joke WhatsApp group name in relation to our MPDA results, which, as everyone who knows us, we do witter on about them quite a lot, how good they were. So that's our team members. Everyone will know we have Dr. Ogabeni as our consultant paediatrician with a special interest, Georgia Cram as a clinical psychologist, and the rest of our team members there. So our QI was to look at the DigiBeat app. We wanted to make sure that our children and young people and the families were going to get information off to them in a timely way and that it was going to be accessible to all. Historically, we'd sent out a lot of information to parents and children on a regular basis, giving out regular updates and to relay any important information such as time changes, about flu vaccines, those type of things. We also identified that a lot of time and resources were being used by our admin support sending out this information. So we decided that that might be an added bonus. So who are we connecting with to improve our work? So the full team are connecting with all of our children and young people and the families. We established a rota for all the team members to take responsibility for providing the updates throughout the year via the news feed on DigiBeat. We were one of the first teams to pilot the DigiBeat app. We worked closely with the DigiBeat team and helped to formulate how the clinic news feed would work, and we identified any glitches as we were going on. So the various posts on the right-hand side are what you can see. So we've posted about COVID. We spent a lot of time talking about COVID because obviously that was highest in priority in our families' lives at that time. The psychologist done daily uploads regarding the lockdown situation in relation to anxiety, challenging behaviour and how to manage difficult situations. Easter advice came from the dietitian, planning for return to schools after the lockdown. We were getting awful lot of phone calls from families at that time, so we would refer them to that information just to give them sort of a breakdown of exactly what advice was current from the government as well as from ourselves. Spring and autumn time changes, which we've already alluded to, updates from the company, so Diasen, Freestyle Libre, and we try to do a Survey Monkey to gain feedback about the use of the app, which we'll talk about in a few minutes. So we try to make it look as attractive as we can and try to alert the families to sort of think, right, oh, that looks an interesting post. We'll sort of have a little look into that. So the likes of the ouch one was sort of, you know, quite a shocking one to say, oh my goodness, what's this is about? So this was about the adhesive problem that people were experiencing with the adhesives around insulin pumps or the CGMs. So that was to get them to partake in the Survey Monkey in relation to that. The newsletter was our newsletter from our consultant, which went out with all the COVID advice and any updates to the MPDA and such like. And you can see the other ones, sort of what they were relating to. The Keep Calm and Manage Stress was obviously one of the psychologist's ones. Okay, so our improvement journey so far. We signed all our children, young people and the families up to the DigiBeat app in clinic before the pandemic made its impact. We just thought that they'd all embrace it fantastic, and especially the teenagers and all of the families would just get on with it. So we found out things were very different actually. Some embraced it really well, others signed up and then didn't check in very often, but now and again would have a little look at the posts. Others lost access, didn't really bother, and the code was then lost. We found that actually if we're not sending out information posts on a regular basis and the families haven't accessed the DigiBeat app, they do lose the code, so they then lose access to the DigiBeat app with our specific information on. So that is something that we're speaking to the DigiBeat team about currently. So we wanted to assess how our parents and families were and our children were using this. So we done a Survey Monkey using the DigiBeat app. We found a poor response from that. We then followed up with a text message to all of our families. And there was about a 30% response to that, and I've got some transcripts from that in 2 minutes. So we're actually currently looking at a different way to get feedback. So we're currently doing some rapid clinics before our virtual clinics. That's a quick 10-minute appointment to do an HbA1c, height, weight, blood pressure in full PPE. So we're taking the opportunity to do a verbal questionnaire to ask them who's accessing it? Are they struggling to access it? Have they lost codes? Are they familiar how to use it? So it's a good practical demonstration of how useful it is. And we're also putting the Attend Anywhere clinic link on there, so they have to go into that and demonstrate that they can use that for the Fridays virtual clinic. We're also planning a text update to our whole caseload with the code and practical tips. So there's some of the text responses. We sent out the message. So the message is in blue to say, want to confirm that you're receiving the notifications, been putting daily advice on from the psychologist, and make sure that the notifications were enabled. We found that some people hadn't enabled the notifications, so they were actually missing out. So there's some of the responses at the bottom. So, hi Val, yes, we've been receiving the updates via DigiBeat. I think the information that the clinic's been giving out has been very helpful and good to refer to. Another one said, I hadn't, I'd download it now, thank you. Another one, yeah, great getting the news on the daily app. And the other one, yes, very useful. So we were quite pleased with those responses. The ones that didn't respond, we assumed that they weren't actually using it. This was our sideline sort of benefit that we actually hadn't anticipated being so great. It's not a very easy slide to see, and I do apologise for those sharing it at this computer screen. On the left-hand side, there is the post that we've actually sent out. So that's gone through all of those ones that I've described there. The amount of paper that we've used, the paper costs, envelopes costs, postage costs, all of those things are there. The time taken to put out the post on the app and the time saved using the app. So we estimated that the running total time saved by our admin support has been 36 hours, which is a great, fantastic amount of time freed up for her to be able to send out lots of other information, sort of, or generate other work, and to help the team in lots of other ways. So that's been vital to her case, to her workload, sorry. The other thing that we didn't anticipate being quite so high is the running total amount saved. £1,156.68, which I think anyone would estimate that's a great saving for the NHS as well as for a team. Okay, so how have we improved our team working? We have the A-Team WhatsApp group, so that's really useful for instant messages to the whole team rather than relying on people picking up emails. We have weekly Microsoft Teams using, obviously Microsoft Teams, sorry, before clinic to discuss the patients, discuss any changes that need to be made to the service provision. So that's been ongoing. We've made changes as we've gone. And during the pandemic, we've worked our way very differently through the pandemic. There's a few of us been working from home quite a lot. We've been going to hospital on occasions, but we were provided with work laptops and all of the facilities to work from home, so which was really useful. We do Attend Anywhere with the patients for clinic reviews and virtual reviews. We used Diasend and CareLink obviously prior to the pandemic, so that's been really useful to maintain contact with all of our families. And we've set up WhatsApp groups with children, young people and the families. Say they have parents that live separately, so then we can actually talk to the whole family face to face rather than say dad being missed out. So, most important piece of learning so far, our new patients and the DigiBeat experience has been really phenomenal. They, from day one, are accessing the DigiBeat, so they learn how to, it's what's reinforcing is the word I'm looking for. It's reinforcing our techniques about injections, about testing, about glucogen. So all of those posts are there for them to access. We've realised that we need to use more regular posts to keep the parents engaged and children engaged, so that they don't actually lose out on that code. We're using Diasend, as I say, in the virtual world. We're Attend Anywhere experience is doing well, and the WhatsApp groups, as we said. How has this impacted and what do we plan to do? I feel personally, and I think the team feels, that clinics will never be the same again. I don't think that we'll ever go back to patients sitting for 2 to 3 hours in a waiting room anymore. We'll need to do more regular posts, and I feel the management of newly diagnosed children will be enhanced. So that's my questions I'd like to ask to you at the end. How do you acquire feedback from your young people and families? Because we've obviously struggled and we've tried various forms of that now. And how do you find out exactly what patients want in their education and want from a DigiBeat app, and how, stuff that they need? So thank you, and I'll welcome any questions for Joanne and I. Thank you.